Okay, good evening, everybody. I'd like to welcome you to the Board of Health meeting, Monday, December 6th. I'm going to start with the action items. The first action item is our two meetings in January. The first and the third Mondays fall on holidays, so we need to discuss what we're going to do to, or date to put something on the calendar, if it's just one meeting or two. So looking at January 22nd or 22.
Do you want to do the second and
When's our next meeting?
December 20th?
20th. If we do
I
the
think-
second, will that be too much time? Will that won't mess people up with their timing on stuff, right?
It's the you've got the holidays in there.
Oh, you mean
yeah.
the second week?
Yeah.
January 11th.
I don't wanna, you know.
So the 10th might be an issue with the amount of meetings going on, but I think if we meet at 5 o'clock like we usually do, we should be okay.
Okay. Yeah, I'm free both of those days, as far as I know. Yeah.
Okay, so we're looking at the 10th at 5:30?
5.
At 5.
And the 24th, or do you think?
I think, well, I mean, it's up to you guys. I think because we're going to run into the same thing in February on the third Monday.
We're just,
We could just schedule the 10th for now and then
Okay.
see what it looks like, and then
Yeah, if we
on the
don't have-
10th,
if we
come
don't
up with the
have
next
work, we can-
schedule.
Yeah.
See what the relicensing should be all done, so it'll just be a matter of how many septics we get in. And
Yeah. Yeah, like I said, I just don't want people to be holding on for 3 weeks when they're waiting for something.
As long as we have
A lot.
48 hours notice, we could post a meeting if we had to.
Yeah.
okay, so I'll entertain a motion that we move our January meetings right now to January 10th at 5 o'clock.
Motion.
Motion Lisa, second Matt, all in favor say aye.
Aye.
Aye, okay, so we're looking at January 10th at 5 PM. All right. So the next item is approval of disposal work permits. So there is a list here, and there are some that we're going to do separate and a couple that we're going to, we have to push until the 20th due to a late arrival. So from the list, we have 19 Rollins Hills Drive, 244 Laurel Street, 45 Winter Street, 136 Plymouth Street, 70 Waterman Street, 1814 Central Street, 1826 Central Street, 1838 Central Street, and 55 Marjan Drive. Okay, so I'm going to make a motion that we accept those disposal work permits as presented. This motion, Lyons.
Second.
Second, Lisa. Any discussions? Hearing none. All in favor say aye.
Aye.
Aye. That passes. So, lots 1, 2, and 15 on Daisy Lane, we received those.
We didn't receive them.
Oh, we still haven't received them. Okay. So, we're going to, hopefully we'll receive those in a timely fashion, and then we can get those on the agenda for 12/20. And then we have 38 Ashley Drive. So 38 Ashley Drive still needs to go to Conservation. So as presented, I'll accept a motion to tentatively accept or approve the disposal work permits contingent upon Conservation Commission approval.
Motion.
Okay, so that's motion Lisa.
Second.
Second, Matt. Any discussions? Hearing none, all in favor?
Aye.
Aye, so that passes. Okay, so I believe that clears up our disposal work permits where lots 1, 2, and 15 of Daisy Lane, we're still waiting for those plans. All right. Now we have some invoices to pay.
Good day.
Okay.
Next up, phone call.
Okay, so the only invoice would be WB Mason for $104.49 for office supplies. I'll entertain a motion to pay as submitted.
Motion.
Motion Matt, second
Second.
Lisa. Any discussions? Hearing none. All in favor? Say aye. Okay, so we're going to pay that. All right, so next up we have mileage reimbursement for our health agent. So we have a request for reimbursement. And you notice on the agenda down in discussions, we also have mileage. So I'm going to present this to approve, if it passes, and then we'll just talk a little bit further down in our discussion about going forward, what the cadence will be and what method of accounting or payment we want to move forward with. So we have an invoice or a request for reimbursement for $157.64 for mileage from our health agent. I'm going to make a motion that we accept this.
Second.
Okay, second Matt. Any discussions? Hearing none. All in favor? Say aye. Aye. That passes. Okay. So, it's that time of year again where we have, I'm sorry. Before we get into renewals, we have a change in ownership of the food service permit at Centuca Pizzeria. And that is,
I just realized it's not in there. It's upstairs.
okay.
So I can run up if you'd like, and we can grab that.
I can run up afterwards. I mean, what do you guys want to do?
Do we,
We're just,
So everything is in order, so
Okay.
Andrea, it's still gonna be Centuca Pizza, but we have someone that is going to buy the business as is, and they're going to they have all their own serve safes and allergens and all of that stuff, so, they haven't passed papers or anything like that, so it'll change hands probably with the new year. So it's a 2022 permit, but I put it separately because it was not a renewal per
Got it.
se.
okay.
All right, so I'll entertain a motion to accept the food service permit for Centuca Pizza for 2022 with a change of ownership. Motion Matt,
second.
second Lisa. Any discussions? Hearing none, all in favor?
Aye.
Aye, that passes. Okay, so here we go. So you have 2022 permit renewals. This is an annual process where a food service, septic installers, haulers, milk and ice cream and tobacco apply for renewals.
I put
And we are.
The list
yep.
for tonight is on the back
Yep.
of the agenda.
So, and their processes are all complete, their applications are all, okay. And this is not all-inclusive, we still have some that are outstanding
Yeah,
as far as.
they were due in by December 10th, so we still have some stragglers, so we'll have
Okay.
more of these to do on the 20th.
All right, perfect. Okay. So I'll make a motion that we accept the permit renewals as listed or as presented for 2022.
All right, second.
Looking for a second?
Second.
Second, Matt. Any discussions? Hearing none. All in favor? Aye. Okay, so those pass. And then we have a Title V, and is that in our packet as well?
It is not, as you might imagine, because you were up here today. We're a little behind today.
Yeah, no, I understand. I
It is
just
not
didn't know
here,
if
but I can provide you, I don't really want to say the address of
No, I
the television, but it, is someone that had their septic system repaired that was failed, and that met all the criteria for the loan.
Okay.
And the funding is there. If you want, actually, if you just want to, yeah. I'm going to pass that to Lisa just so they can see what they're voting on.
Thank you.
All right, so I'll accept a motion to approve the Title V loan as presented.
Motion.
Okay, motion Lisa,
Second.
second Matt. Any discussions? Hearing none. All in favor? Aye. Okay, so that passes. So that completes our action items. Excuse me. All right, so, Jean Marie, could you just give us an update of where we are from a health agent perspective?
Okay, as you've seen, we're doing a lot more new construction perks. I'm doing 3 to 4 lots a week, and probably 2 to 3 repairs are coming in a week. I expect that to continue as long as the ground's pretty soft.
Yep.
Okay, so we're going through those. We had ongoing complaints regarding Chinese food establishment. We're working on it. It's a slow process, but we'll get there. You know, we'll get where we need to be soon. Okay, I also checked some of the other food places in that strip mall, and I'm not seeing an issue there. But there is an issue outside, and it kind of runs through the whole strip mall, which with the drop ceiling, it's gonna, doesn't matter where it generates from, it's just gonna be there. So we keep working on it. Approved a tie-in for the sewer for the cinema and the carriage crossing strip mall. So that's gonna go forward. The COVID numbers have exploded during the last weekend as we expected because of Thanksgiving. It's about 50% of my workload, and it's probably 75% or more of Sue's. The reason for that is she's in the office a lot more than I am. I'm out doing inspections, so I wouldn't be answering the phone while I'm out there. But it is a lot of work, and it really has exploded. We did get the Phelps grant. That was with the collaborative, 3 Bridgewaters and Raynham and Middleborough and Halifax. We're looking for a grant of 1.5 nurses so they can cover the 7 days. And also something called a community health worker, which would be the substance abuse, nutrition, mental health aspect that we were kind of looking at and thought was coming into play. So we're going to try and get what they call a community health worker, is what
Okay.
that whole statement's called.
Would both those individuals be under that grant?
Yes.
Okay.
It's a $300,000 grant for the 5 towns. And if we get it, which we have a pretty good chance of it because we don't have that kind of help right now, it would go in January 1st. And it would be for about 2 to 3 years.
Okay, and then my other question was, so 1.5, that'd be 60 hours for the 5 towns?
Right, yeah. West Bridgewater and Halifax are kind of in the same boat with the same number of hours, 6 per week that their nurses have. So the nurse would be 1 nurse for the 3 towns.
So the process, how does the nurse get selected? Or is it hours that we just use our internal nurse, or they're to increase their?
No, there is an administrator in Halifax has stepped forward to be that. And that the review process will be through Halifax and
Okay.
paid through Halifax.
So Halifax is hiring a nurse that we're all gonna share, and we're gonna reimburse Halifax for,
Well,
The grant.
they'll
state-
get
the
the
grant
the
will,
grant
yeah.
will, yes,
Our
as
person,
with the
right.
community health worker.
okay.
So the 1.5 hours, or 1.5 full-time equivalent, that's just for the nurse, so there'll be other hours separate for,
They were
Yeah.
looking for a full-time community health
right,
worker.
okay.
That's actually a designation by the state. It's a certified position by the state, like an RS is or an RN is. Or
But that person wouldn't be contacting or tracing or going on Maven, right? That would be more of an emotional social support?
hoarding things, homelessness, suicide, substance abuse, kind of.
Is that also being handled as part of the grouping in 5 towns, or is that something we're looking for on our own?
It will be grouping for the 5 towns,
So
yeah.
we're still, again, it's about 6 hours a week
Yep.
for each town for, okay.
Right, yeah,
And then Halifax is gonna be the administrator for that as well?
yes.
Okay.
Yeah.
Okay. So you have on here, is there additional money available to pay a nurse to work in December?
We decided we sort of could slide through with that.
So is that something that we'd be, again, looking to,
That I was thinking was more, would be more from the, tying back to the COVID, which was number 5, with the CARES money that was left, that they had said we had,
Is there CARES money left?
200,000,
So-
available to us, or?
The whole town.
The whole
The
town,
town.
yeah, no.
Okay.
the whole town.
So I'm kind of gonna jump in and just say, so when we hired you as the health agent, we knew that this could possibly be the case.
Right.
And I know you're out on the field, but I'm thinking more along the lines as maybe we need to restructure where and when you are out of the office if possible, like maybe do the field work Monday, Wednesday, Friday, and then be in the office Tuesday, Thursday, or whatever designated days, just to offset the COVID numbers. I know in the past, that's kind of, with the town nurse, I know sometimes the cases can jump up on the weekend and whatnot, and then she's kind of responsible to do those as well as her 6 hours. So is that something that you could look at and maybe restructure so that it's not like you're out of the office all week? I don't know what the schedule for December will be, if the installers permits and whatnot will kind of quiet down because of the holiday.
Well, Sue and I have been trying to book perks Tuesdays and Thursdays. Sometimes they need consecutive days, but, because you can't always keep opening a site and going back to a site. Like I'm working out in the field next Monday and Tuesday for one developer. He wants 15 lots. So that's a 2-day thing. So we try to structure it that way. We haven't quite got back into routine food inspections, so those are being done as required when I get a complaint, basically now, and that hasn't been too bad. So, yeah, I've been trying to do that. Fridays, I was doing Maven a little bit this weekend. I definitely jumped on this morning, and that's the way I want to do it. And I don't remember what days the nurse is available or not available. Is it Fridays and?
So we have a new volunteer nurse also. So our regular nurse, she's just not available on Wednesdays at all, and Fridays
okay.
is limited. But we have a new volunteer nurse, Karen Lynch, who was the central school nurse for years and has been the Whitman public health nurse. She just retired from there, that lives here, that just wants to do community service, and she's already on Maven. So Maven allowed her to have 2 towns. So she's just picking up cases as she has time during her day. So she was able to pick up 2 cases this weekend. She picked up a few today. And she's been in this for the year, so she's also with Whitman because she's worked with some of the daycares that we share, so which is good too. She's got relationships.
How's Maven been going for you? Because I mean, obviously, the last time you were in an office like this, it wasn't a pandemic. I'm not very familiar with how long we've had Maven available. So
And they have changed, like, I did paper this weekend because I came into Sue this morning and I went, what am I missing? And she goes, oh, they do it this way. In order to get in and to log in, they do it differently. And that's what I was missing in, trying to get in on the electronics. So I get in and we fix that. It's pretty much the same. It gets complicated when you're dealing with a ton of things. And just by circumstances, I hit all the unvaccinated people this morning, just by chance. So for me, it was like, that's who I was trying to deal with this morning. And she was really good about, no, you got to do this. No, you have to do this, and working it out. Because until you sit in Maven and do it, it can be very complicated. The way you do things in there. So we're working through that still. But I got on and did a couple of cases this morning.
So when Sue goes on vacation, are you going to be up and ready to
Yes.
function on
Yes.
Maven on your own?
Yep.
Because that's going to be an issue as well, especially where, I'm not even sure when your vacation is, but I'm assuming it's around
I
holidays.
tried to pick it to be the
She
least
should be okay.
inconvenient for the town, so I took the week after Christmas, so that really, town hall is closed Friday, Saturday, Sunday,
Yeah.
Monday.
Yep.
And we
For 2
won't do
weekends in a
perks.
row, so it's really just 3 days.
Yeah.
But the problem is that I've been trying to retrain people. I've given everyone Jean Marie's. name and phone number, but after a year and a half, they still tend to email me and call me, and even when I try to, point them in another direction, so it's gonna be hard, I have to just work on.
We're just gonna set up an out-of-office email.
I will
that
be, I
has
will be.
Jean Marie's
I
email
did
link
make
in
a
it.
stern promise to my family that I would not touch my phone for that week.
Is it your phone or is it the work phone?
It's my
her
phone, but I
phone.
have work email on my phone.
Okay. I was gonna say, 'cause you can always
So,
transfer
yeah.
the calls for a
And,
week.
yeah, so I will leave a voicemail and I will leave an email because I think, for everyone's sake, if I don't take that week, there's gonna be some trouble at the Mulway House, so.
So who
It could
has
be over.
access to so an inbound call comes in, let's just say it's after hours, and it goes to the department phone,
The voicemail, yeah.
voicemail in there. So what's the process there to gather those and disseminate the
We
message?
just get them the next morning, but usually if there's like a vacation coming up, we leave a specific message on the voicemail. Like maybe we want to do that now, just with the surge coming anyway, saying if it's after hours and it's urgent, you can reach and, she's got the emergency phone, the phone
Right.
number. Like the police and fire have that phone number
Right,
already.
right. Well, that's what it's there for.
Yeah. The selectmen have it, you guys have it.
Yep.
So, a lot of people will use email to contact us after hours anyway.
Yeah.
We don't really get a lot of phone messages over the weekend. We get a lot of emails.
No. I got
Okay.
quite a few emails this weekend about people not wearing masks in certain places, and I did answer them Friday and Saturday nights.
So, okay,
Emailed
so
them.
what you're saying, we don't get a lot of voicemails?
We don't get a ton of, early on in the pandemic we did, but we've got a lot of people trained now that if it's after hours, the best way to get us is via the email, because we're pretty responsive on it, so. And we get a couple, but like, for instance, Monday morning, this morning, I came in and we had one message since Friday, so, we
Really?
don't get a lot of voicemails over the weekend. Yeah, people know we're not here, number one, but a lot of people figure, well, maybe we'll try the email, and that, they tend to know how to get us, especially like our regular, like daycares and businesses that know that we check our emails, so.
Okay, so the email, it could go to anybody, like first contact.
So, no, I mean, they have to email a person, so, if they email me when I'm on vacation, they're gonna get a message that says, I
You're
don't
out
have
of the
access to
office.
email, please email, and we'll have Jean Marie's email address on it,
Right,
Yeah, I'm just looking to see what came in.
with anything you need help with while I'm away.
right, okay. Let's see, so the email could be just anybody, either emailing you or emailing Jean Marie?
Yeah, for example,
There's
like
no-
last night, I had 2 basketball coaches emailing me with some COVID issues. And they had my contact information because I dealt with them last season during basketball, so. And it was something that really Jean Marie's not really totally up on yet, so I didn't want to just pass it off to her because it wasn't a simple thing, So, I was on the train at Edithville Railroad trying to figure out contact tracing via email, so it just, but sometimes it can't wait because now it's 7 o'clock at night, there's school today, and people are waiting to find out if their kid can go to school, can they not go to school, can they test and stay, so.
That's gonna be something we need to get you ready
Yeah,
on.
yeah, and we'll.
She's gonna
and-
be gone for a week right after Christmas. It's gonna be
I
just
got
like
it.
right after
Yeah.
Thanksgiving.
I
if
had
not
the
worse.
nursery school, and I had
And-
7 from the Y this weekend. They came to my email.
Okay,
The East Bridgewater mass.gov.user comes to my email. It gets sent to Jay Joyce. So that's how I got them this weekend. So I think someone's getting into the,
and we're all caught up on getting back to them. Are they comfortable with the information we've been able to supply them?
for the most part, yeah. We still have people that just don't accept what you say.
Okay.
I don't know what,
So, do we, when we're circling back with them, do we provide something a little more detailed as to, not just what you're saying, but also here's the written, right, do we send that along as well?
example, this weekend, one of the ones I got was, someone was upset that their wife was not wearing, the exercise class, the adult exercise class was not wearing masks. And he didn't feel that they were social distancing. And I said to him that the mask mandate had been lifted.
Right.
And that they were no longer required to. I wasn't sure of the whys policy, but that if he and his wife were not comfortable, perhaps that she should be wearing a mask. I could suggest to her that she should wear a mask and to protect themselves.
Okay.
Probably not the answer he wanted, but
unfortunately, there's two sides of it, and you're gonna get resistance from both sides, so.
Mhm. Absolutely, yep.
Okay. All right, so I think we need to explore a bit more about that $200,000 that's still available to the town.
Well, it has to be used in the next 2 weeks, so it's not something, we can't hire somebody with it. So it's gotta be used by December 31st.
Great.
And it's like purchase, so that's what, remember we talked about with, him today
Yeah.
about possibly purchasing at-home COVID tests to hand, not to test people, to give them. So we're looking to see if that's something that can be covered. A lot of people have been having trouble getting tests. So just, if we have to use money, try to think of supplies. We have
Binax
plenty of yeah, like Binax,
Oh,
yeah.
well, you can get
We have
those at
plenty of,
Walmart.
well, you can't, only about one per person right now because there's a shortage, so,
They're not as reliable anyway.
no,
so.
No, I
no,
know.
but, you know, but just sometimes people just want to, you know, a little something, but we're trying to, so the money, you know, you have to have an approved use for it, and we have sanitizer beyond what we're ever gonna need. We have gloves, we have masks, you know, we've got everything, so it's like, and, you know, we're not, you know, we're really not set up to do our own testing, which we'd have to have set up by December 31st too, so we're trying to think of, okay, what could we buy before December 31st? So it's not really, it couldn't really be a salary per se.
I don't know, it's a slippery slope with the Binax, and, because
I know.
I've dealt with it myself. In theory, people who take the test and test negative feel, oh my God, I'm great. But then you run into the problem of people who think that that test is actually an accepted test, and
Right.
in most cases, it's not, it's a PCR.
Yeah.
So like, I know I've run with Halifax, there was a cross situation that I was made aware of because I knew the person, but their kid was a contact in preschool, and they bought a Binax from Amazon. They have a box at home, so they Binax and sent the kid back, and the school, you can't do that. And then it was like, well, I have a test, so it's like,
And that's been a
I
problem
think
at the
that would be
schools.
like a
Yeah.
lot more
Yeah.
phone calls if
Yeah.
you start handing the tests out and people aren't aware
I
of.
think he was thinking more, that's Charlie Seelig, was thinking more about for like, like town employee, like, so, you know,
Yeah.
town employees to, you know, if you're feeling sick. He was trying to think, because I guess in Halifax, the fire department does rapid tests on an employee if you need it. It's something they got through the CARES Act, I guess.
Aren't the Binax tests the ones they're using in the
Those are the
schools
ones,
for
yes,
testing
those are the
today?
ones that
Yeah.
DPH recommends for a
But they're-
rapid test,
they're-
yeah.
They're the only one that there is. However, there's a lot of discrepancy.
Okay.
I mean, there's a lot going on with the testing anyway. I know that now, and it's not really like publicized, but people who are vaccinated who then in turn test positive, they're finding their viral load is so much lower that they're not contagious. But they're
Right.
still working on it, so it's not like a factored in equation yet, but I don't
It's
know.
forever changing,
It is every day.
every day.
Every day.
It certainly is.
Okay. Anything else?
We have office updates.
Yep, I just, you know.
Well,
on
as far as this
particular
goes-
topic. So,
We could go on forever, but
Yeah.
that's
I'm sure we can keep on.
but, you know, as we talked about this afternoon, I just want to make sure that if there's a resource that's out there that we're underutilizing, or if there's another avenue that we can lever to make sure that, you know, we have the resources that you and you can get both of your jobs done without it being like drinking from a fire hose. So if there's, you know, even the slightest thought, just, hey, if we try this, I mean, we should really, you know, there's no bad
Well,
idea.
hopefully the grant takes care of it. I mean, if the grant doesn't happen, then
It-
we'll be going to FinCom to figure something else out
Yeah.
maybe, but.
Yeah,
It
yeah.
just,
No.
you know, it's, the winter is probably, I don't know, that's not my area of expertise, but,
We're not
again,
alone.
Just want to make,
No.
we're not
all
alone.
all the towns are in the same boat, so I'm sure government level wise, there is gonna be something coming forward,
Funding or
hopefully.
something, yeah. Hopefully.
But again, I don't want to stifle any ideas. If there's something that you guys think about, anybody comes up with that says, hey, you know, have you tried this? Have you thought about that? Maybe the answer is yes, maybe the answer is no, maybe it's a possibility, maybe it's not. But,
And maybe I don't know, maybe putting on the website that, to alleviate the emails and calls, putting something on the website saying, currently the guidelines are, we do not have a mask man, you know what I mean?
Oh, the
And
mask,
then
Right.
if they can read it on the
Yeah,
website,
I
maybe
haven't
it'll
gotten a call
delay.
For a while, so.
Yeah.
Well, I think as people get more anxious, the calls might start coming back.
Yeah.
I'd like us to take a look at that too, just maybe, if we can all take a look at the website in a fresh set of eyes or a different set of eyes, to make sure that, to your point, Lisa, that we have the most updated information. If there's something, if we can prevent a call from coming in, that could just be answered by somebody looking, or maybe they went there first and didn't see the information. Well, it's if we can have this communication in as many places as possible, I think that may take, to Lisa's point, that may take some of the burden off you guys. You're still gonna get calls, but anywhere that we can cut that off and have somebody be self-sufficient, and here's the answer, then.
Like a tornado.
Yeah, spread
How
the
many
lights.
calls have we gotten in the last couple of days that have been concerning the school's test and stay program, and who is eligible for that?
Last week, oh gosh. Well, we did a press release last week,
Yep.
but before the press, that's why the press release started. Before the press release, probably a dozen.
And since the press release?
Just one today,
Okay.
yeah.
So that we think that's worked?
I guess the school sent it out to all the parents, I think, through a
Yeah.
subscriber thing they have. The town sent it out through the e-subscribers, so, I hope so. I mean, we still had some people that don't like it, so they still try to I know people went to school today expecting to get tested to say that we're not eligible. We had, our nurse had an incident today where, a mom sent the kids to school, today, for outside of school contact because she thought they were eligible without checking, so, that's gonna happen, and we got them and sent them home, and.
So who is eligible for test and stay?
Just kids that are identified
Contact
by the
the
school that were exposed in school.
So if they're exposed outside of the school,
They are not
they're
eligible.
not eligible for test and stay?
It's
Okay.
an automatic, yeah.
Yeah, follow the.
I know the
quarantine.
answers
She
to
knows
these
that, yeah.
I just need
And-
someone to say that out loud.
Well, yeah, I know.
And even if it was a gray area, right now, the school is so busy with the
Mhm.
amount of kids they're testing, staying, that, maybe if it was quiet and there was a gray area, like a daycare or before school and after school, they might be able to consider it, but
What if I'm
they're
in
over
the
their
school
heads.
building when I'm a close contact? Does that count, or does it only count if I'm actually in school during school hours?
during school hours. Well, I shouldn't say that. If you're a part of the after-school, extended
If
school
it's
day.
a
Yeah.
school
Yeah.
program.
School program,
If
correct.
it's not a school
Not if
program.
you're playing EBYBA or EBSA or whatever. all the
I
other
think
ones
it's
are.
still fueled
The
by
acronyms.
social media when some
Oh,
person
unbelievable.
puts on, the numbers are up, people are like, oh my God, it's under control.
Well, I did have two calls later that they wanted to know the numbers.
Yeah.
And so that was my last point. I didn't mean to cut you off. I don't know
okay.
if you were able to provide that or not. I did receive a number of reach outs from friends on my personal phone, personal contact information, whatever you want to frame it up. That again, they were looking for numbers. So we're on track to be able to publish on Wednesday.
I published today.
Okay, so we did get them published.
I had somebody ask me, I had somebody reach out and ask over the weekend. I just couldn't, I can't get to it, and.
No, I understand. I just.
I'm
It's
so far,
available to the
yeah.
public. They can
Well,
look at it.
the East Bridgewater numbers aren't
Yeah.
available.
Well, you can go on CD.
yeah.
It's a lot of
Yeah.
navigating. You
Yeah.
can find it, but
So, I
Raw
did
data
publish
is
today on
there, but
Facebook
it's-
and on the website. Since the day after Thanksgiving, we've had 161 cases, compared to the same week last year, 166. So about the same,
About
but
the same.
during vaccination, so, and then comparably, we had 15 school-age kids last year at this time, 47 school-age kids, and 5 additional kids under school age. So it's definitely hitting like a different,
plateau, yeah.
different group, different age group.
Well, I
pattern.
think people need to be aware that even though the numbers may correlate in similarities as far as the
Last year.
influx,
Yeah.
because people are vaccinated, there are always going to be COVID cases. It's never going away. But because they're vaccinated and they're boosted and they know how to handle the cases, it's not at the severity that it was last
No.
year where people were getting extremely ill.
And I
What
still,
are our hospital numbers?
so right now, to the best of my knowledge, we only have one person in the hospital. We've had a few people admitted for, and I'm gonna say it wrong, but the, when you're vaccinated, you can go in for is it plasma?
Oh, the
or-
gamma, the
Yeah, yeah.
infusion.
So in order to get that, you've got to, some people have to be admitted overnight, some people just for a few hours, so we've had a few
So
people
if
go
you
for that.
test positive or you're extremely high risk, there is a non-FDA approved treatment that they will give you if you sign release. And it's either 4 simultaneous injections in 4 different areas, or you can be admitted overnight only because you have to be monitored for vitals. You can get an infusion. It's a one-time, hour infusion of this gamma globulin name that I cannot pronounce. And it's,
No.
Yeah. Because we've had a few people that say, well, what do you think? And I said, that's between you and your doctor.
Right,
We
a
can't
lot of
recommend
times,
that.
like
We can't recommend
in
that.
senior nursing facilities, that if they have like a little bit of a cluster, the government will come in and offer it.
Right.
Otherwise, it's like hospital, like you
Yeah.
can't just go, oh, hey, I want to get that. It's
Yeah.
not really, because it's not approved by the FDA yet.
Got it.
So, and then just, adding on to that, what you just said, so the nursing home is right now in lockdown. They do have, I believe it's currently about 9 cases, so they are closed to the general visitors, just allowing people in for hospice care. And they are, they're being monitored by DPH and the epidemiologist over there for their protocol. So right now, they're looking at like 14 days. So they've done a pretty good job of keeping everyone informed there. They send out like alerts every day on everyone's texts. I did email the police chief and the fire chief just to let them know that that it was over there and that the numbers were just up in general. We don't provide addresses anymore. But like I keep saying, the numbers are high, and yes, it's alarming. And I do see that people going to school that shouldn't be going to school, and Heather does too. But also, the numbers being high means that people are actually getting tested. Yeah. And that's a good thing too. So that means people are getting tested and they're staying home if they're positive. So, it could go either way. Sometimes the high number is an indication that people are doing the right thing and they're getting a test. And then we did have a booster clinic. When was that? The Monday of Thanksgiving, we had a booster clinic with Oscar Drugs.
22nd,
Yeah.
I think.
At the senior center. They had 78 people come for boosters. That was before everyone was eligible, so it was like, if you met the criteria at that time. Nancy Hill asked for another one because I guess she's getting a lot of calls, so they're coming back the 14th, and then I got an email from the school over the weekend that they're going to the school on the 13th for teachers.
Oh, that's
For
good.
boosters,
So the 14th is more general, be open to everybody.
everyone, yeah, anyone that wants it.
What was that other date for the teachers?
The day before, the 13th.
Okay.
13th for teachers and 14th for the general public at
Yeah.
the senior center.
And we did, I was telling Matt when he was just up there, we did reach out to the president of the Youth Basketball Association just to, so that, we kind of alluded to a little bit when you were up in the office earlier, Rob, but we had a webinar, we have a DPH call-in Tuesday, and so contact tracing has changed a little bit because the CTC is calling, they're now saying, if you get a voicemail, leave explicit instructions on the voicemail for the person. Don't just say, call me back, because so many people are calling people 4 and 5. Like Heather's called people 5 times before she's given up, and it takes a lot of time.
That's a lengthy voicemail.
It is, but sometimes people just won't call you back because they don't want to talk to you because they're afraid
Right,
you're going to
right.
ask them who their friends are or whatever,
Okay.
and so it's better at least to get them the information. And then they also are saying, people, you need to reach out and ask your cases, like, you need to think about who your contacts are, and you need to tell them that they're contacts, rather than us calling all of their contacts, because the CTC is gone and there's just not enough manpower statewide for everyone to call every contact. So then this weekend, when we had all these basketball teams, we did a lot via email because it was impossible to make all those phone calls. So I did reach out to the president and it's Brett Pohl, and just say, this is what the protocol is for a contact. If you have a case and they meet that protocol, if you could email the team.
So did they provide us with an email distribution list, or?
They did, yeah.
They
Well,
did.
yes, they did, but but really the responsibility should lie on the case or the coach to help with the outreach for the team, because it's just impossible for all of us to keep up. So there's going to be a lot.
So can we provide the coaches or the president with the verbiage to send
We did,
out?
yeah, we did,
Okay,
yeah.
all right. Did we email it to the? They supplied the email list. and we
Nope,
emailed-
they
okay,
emailed their
okay.
team. We provide
Okay,
the wording
that's
for
what I
what
was
the
hoping.
guidance is.
Yeah, okay.
But, some of those kids did show up to school. So then then Karen was, chasing them down. So,
Okay.
it's going to take a little while to get it working properly, I guess.
So is youth sports governed under I know they're not
I don't think it is,
general,
but they
the
told me they were following
guidelines.
it. Yeah, they told me they were following MIAA guidelines, but I don't think it's governed under it.
I know they know it has
Yeah.
nothing to do, but as far as COVID goes, because I know with MIAA, if your kid is vaccinated and
Yep.
exposed,
Yep,
there's no
vaccinated,
quarantine.
exactly,
so-
yeah, vaccinated, and that's what we put in the press release, trying to encourage people to think about vaccination, because fully vaccinated kids, sports players, anybody, if they have no symptoms, they don't have to do the test and stay in quarantine. They can go to their basketball game, they can go.
That's why my son bought one.
Yeah, so that's why, and I thought they did a pretty good job of that, writing that in the press release too, if you read it about the vaccination, so. That's pretty good.
So are you comfortable with office updates? I'll kind of be inclusive as what we talked about, or is there anything else that you'd want to?
Oh, I think that, well, that was, I think, what I just.
Okay, I just wanted to. I thought so.
I was trying to think if anything else has happened in the last 2 weeks, but just, the fact that, yes, I am reminder that I am taking a vacation, so the 20th, I'm
Yeah.
gonna try to get everything else signed, get it out the door, and, before I leave, I'll make sure that everything's turned over to Jean Marie.
Okay. Well, congratulations again on being selected as the marshal for.
Oh, thank you. My granddaughter had the time of her life.
That's awesome. That's awesome.
That's what it's for.
Well deserved. Congratulations again. Okay, so our discussion on mileage. Now, it's my, again, however we want to do it, we'll move forward with a stipend or actually reimburse for actual mileage. So the actual mileage was just updated this year at 56 cents a mile. So Jean Marie's keeping track of her mileage, and then she's worked out a calendar and submitting, I would see moving forward, submitting that on a monthly basis for us to approve. There's a couple other ways to go about it. We can look at that as a stipend, or getting back to the actual mileage. We could do it quarterly. That just means that Jean Marie would have to wait a bit longer to get reimbursed. And then there's also, we could come up with a stipend. Personally, what I'd like to see us do is to get a little bit more information under a belt with actual mileage. I know it's a little bit of paperwork on Jean Marie's part, and then we can get kind of a better feel on what the actual miles on the road are.
Especially as she gets more familiar with the town as well.
Correct, sure.
I had a bad day.
Listen, when she told me she wasn't up at Thatcher Street, I don't think I would have been able to.
At one point,
say
Bob
that either.
did what she's doing with the calendar, but then he found it, so there was an option of doing just a quarterly stipend, so he opted to do that rather than, because it can be, like, you have to make sure, like, somebody might call you for an inspection and you forget to write it down, and then, so you have to try to account for every place you've gone all day. So he
There's
ended
an
up
app for
doing
that.
and I think Patrick Franey, that building inspector, also does the quarterly stipend, so.
So it's up for discussion. And we can.
Well, there's an app for it, but you have to submit written documentation for the accountant, so you just
Yeah.
can't say, this is what I want, yeah.
So either way, she's gonna have to submit something. So we already have, our previous health agent was doing quarterly stipends.
Yep.
We have someone that's doing quarterly stipends now. Is that something that you would prefer?
I just need to know which way you guys want to do it.
Okay.
And weekly's kind of a pill because it still becomes
Another documentation.
mostly monthly, because by the time you meet, and
Mm-hmm.
so either monthly or monthly's fine. I've usually done it monthly. That's fine with me.
Well, is there any objection to going with? I know, again, like I said, it's a little bit of. Got to remember the paperwork, but we can revisit in a few months in the spring. We'll do actual mileage now and then revisit it in a couple of months.
I'm fine with that.
Jean
That's
Marie?
fine. That's fine.
Okay, so I don't know if that's an action item that we need to vote on.
No, there's something to talk about, yeah.
Yeah.
Okay.
Okay. So just keep submitting on a monthly.
Yep.
Right, and then in the spring we'll take a look at it, or maybe before the spring we'll take a look at it to see how it's working, and then we can keep going that way and make a different decision.
Okay.
All right, great. Plan approvals.
So I put this on there only because, or only so, we're going to get repairs that don't need variances.
Right.
So are you comfortable with me signing off on those so they can go ahead with them? Because variances, you probably should look at. I mean, most of the time, that's what's going to catch some neighbors' attention. He's too close to wetlands, he's whatever. And wait, or how do you want to handle those?
So by repairs, do you mean something that's come through as a repair that needs follow-up?
An existing house that doesn't require any variances, it's not too close to groundwater, it doesn't need any variances or board action. I could, my past towns, I've signed off on those. And just let you know as a monthly update under agent action that I signed off on these plans. And you can look at them if you want to, but it's just so they don't have to wait.
Would they need our signature anyway?
They wouldn't need your approval if you want me to act as your agent.
You would be, under this plan, you'd be able to sign as our agent?
Right, right.
But, Title V allows for.
Yeah, it does.
For that to be designated to the health agent.
Right.
On repairs.
Well, it allows it on any plans, but you can do it just for repairs. And then ones that need variances come before you, because they usually, the code
variance,
says
we should
it has to
still
be
see,
discussed
yep.
at a board meeting. You know, those kind of things, like Ashley Drive, for example, would need it. But there were 2 or 3 tonight that don't need any variances. And, you know, I could have just signed off on those and then sent them through, and you can look at them later.
So we're talking about plans that are only repairs that do not require a variance.
You can do it that way. New construction, it could be the same. It's up to you guys.
Thoughts?
Are these plans that we're delaying people? We're not talking about emergency repairs, like, oh my God, we have to fix this now. We're talking about, our septic is failed, it's failing, we're repairing it, sort of thing?
Yeah.
Okay.
You know, some of them are for houses. A lot of Title Vs are done because they're selling the house.
Yeah.
If it's an emergency repair, I would just pop a tank in it and have them pump it till we got to it.
Mhm.
You know what I mean?
Yeah.
We're never gonna, you know, as far as I can see, we're never gonna have overflowing something down the street routine. Okay, that would be, I would pop a big tank in and somebody would just pump it until we got an engineer out there and they repaired it. These are ones that don't need groundwater separation and meet code as is without any variances. Like 55 Mark Green or 19 Rollins Hill Drive, I think was another one today. And maybe 17 Waterman, I think, didn't need a variance. I looked at so many, my brain went by the time you get through, but.
I'm okay moving forward in that limited basis for right now, having plans that are that don't require a variance, that are repair only. You delegate the approval authority to the health agent.
Can we continue to get the same report on them, even if it's been approved, just kind of throw it to us, hey, these are the ones I approved, here they are?
Yep, same thing,
Okay.
yeah. Just so you know what's going on, because you know when the shovel goes in the ground, the neighbors want to know.
Mhm, mhm.
Yeah, I get it.
Okay, even though this isn't on an action item, it probably requires a vote. So I'm going to make the motion that we delegate approval process to the health agent for plans that are repair in nature only and do not require a variance. So that's a motion, Lyons.
Second?
Second, Lisa. Any further discussion?
Does that motion cover what you're looking for, Jean Marie?
Yeah.
Okay. And yeah, good.
Okay, any other discussion?
No.
Okay, hearing none, all in favor?
Aye.
Aye. So that passes. Okay. All right, Jean Marie, thank you for that. And I do not have anything else that was not anticipated. Does anybody else have anything they'd like to?
Sue, do you want to talk about the meeting with or do you want to talk about the meeting with the town administrator?
Sure, we had a brief meeting, about 45 minutes with the new town administrator. And it was just kind of get to know who's who, discuss, pretty much daily operations was taking up most of our time, very much the topics that we touched upon tonight. Tried to noodle through a couple of opportunities again, as Sue brought up with the 200,000, what are our opportunities there? And we talked briefly about putting together a goal package for 2022 and beyond, which would be something that we might be missing, something that we might be able to enhance, and then if there's long-term opportunity. So I know we're pretty much knee-deep in COVID, and obviously Jean Marie coming on as being new, but I'd like for all of us to think about some things that we'd like to see as a board, as well as the team in the office, to put together a few goals, something that we could accomplish right away that we're missing, that maybe other towns do well, and for whatever reason we're not doing it, and then any long-term goals 3 and 5 years out, anything that we can limited amount of resources that we can gauge. I mean, you brought up an excellent point about rebranding and bringing a couple of areas to kind of highlight those. But again, if we put together a goal package as a team for 2022, and then we can start putting a timeline and some numbers if we need resources to achieve those. Did I miss anything?
No?
Well, just I give you a copy of Charlie's going to give to the selectmen tonight. Just wants to update the town policy on, like, for employees, if somebody's not feeling well, if they get exposed to COVID, because our old policy doesn't talk about vaccination.
Okay.
So he's going to be putting it to the selectmen tonight. So it's really a selectmen's policy, but just so that employees have something up to date. If they're vaccinated, they know what they can and can't do.
So that's a good point. Thank you for that. That was very similar to what we did with put together a joint press release with the school and the Board of Health. It'd be pretty much very similar. It would be just going out to town employees and departments as to what the policies are. Pretty much just a coordinated effort, communication. Forgot about that. Thank you.
That's it. I think the selectmen are waiting for our meeting room, so we have to.
Oh,
sign
okay,
it.
all right. So that's
They're on
okay.
6:30.
All right. So if there's nothing else, I'll entertain a motion to adjourn. Motion, Matt.
Second?
Second, Lisa. All in favor, say aye.
Aye.
Aye. Okay, and that concludes our Board of Health meeting for Monday, December 6, 2021. Thank you, everybody.
I have to go upstairs and grab the big piles of food service permits for you guys.